Thank you. I'm very happy to have this opportunity. I know that the senior faculty have heard a lot of what I'm going to say today many times, but maybe not for a while. So hopefully I won't bore them, but I know there's a lot of people who haven't heard the presentation before as well. So we will start. I have nothing to disclose except we do have funding from Thrasher and Bill and Melinda Gates Foundation and from NIH, but none of them are directly involved in any of the studies. So today I want to talk about the basic physiologic effects of delayed cord clamping, also known as placental transfusion, which is the term that more and more people are beginning to use now because it includes both delaying the cord clamping and also cord milking. We're also going to talk about show you some new physiologic evidence related to delayed cord clamping and look at the current evidence from the clinical trials available, and then review briefly our progress of our ongoing trials here at Women and Infants Hospital. So first I want to talk a little bit about the basic physiologic effects of delayed cord clamping. And the blood volume in the baby and the placenta, which is the fetal placental blood volume, is about 110 to 115 milliliters throughout gestation. At term, however, about 2/3 of that is in the baby and 1/3 of that is in the placenta at any point in time. However, at 30 weeks, for our pretermers, they're so much smaller that about a half of the blood volume is in the fetus and about half in the placenta. And that's important to think about when we clamp their cords right away. About 40 to 50% of the cardiac output flows through the placenta at any point in time, and only 8 to 10% goes to the fetal lungs. At birth, however, the babies need 40 to 50% of the cardiac output to go to their lungs to establish air breathing, so it has to happen extremely rapidly. So just as an overview, here's what's happened. So we have our baby in utero. We have the placenta on the left getting 40 to 55% of the cardiac output, doing all the oxygen and all the gas exchange. And on the right, we have baby, those aren't lungs, but it's best we could do, 8% of the cardiac output going to the lungs. So if the baby's delivered, and we cut the cord right away, this is what stays. About 1/3 of the blood volume stays in the placenta and does not go to the infant. However, if we wait just a bit, to cut the cord, it allows for the baby to establish breathing before the cord is clamped and to take the amount of blood that he needs to fill up his lungs with the blood to support that huge increase in cardiac output that needs to go there. So about 1/3 of the blood volume can be returned to the newborn if we wait for the baby to breathe before cutting the cord. Now so let's go on, and I want to tell you a little bit about factors that affect placental transfusion. We're going to talk more about that later because I have some new data to show you on that. So the time of cord clamping affects how much blood the baby gets, gravity, whether you hold the baby up or down, whether the mother has uterine contractions, whether the mother gets any oxytocin, and whether you milk the cord. All of those things can influence it. This is a classic slide, classic study, actually, from done by Dr. Yeo at the Karolinska Institute back in the late 60s, just after Dr. O finished his stint there. And she did some very classic studies. I used to apologize for using old data, but in rereading Poland and Fox, I realized that most of the references are in the 40s, 50s, and 60s on basic physiologic data because it was done then and it's not being repeated. But anyway, this shows you percent change in blood volume and red cell volume due to delayed cord clamping. And on the left, the y-axis is either blood volume or is either milliliters per kilo or percent change. The dark blue column shows what happens when the cord is clamped in 5 seconds, And you can see the babies get about 70 milliliters per kilo in column 1 if you clamp the cord immediately. However, if you wait 3 minutes, as in the red bar in column 1, you can see the babies get over 90 milliliters per kilo blood volume. Column 2 shows us percent change, and you can see that the baby gets about 30% more blood volume when we wait 3 minutes to clamp the cord. Column 3 shows you red cell volume, and you can see the babies get about 30 milliliters per kilo of red blood cells if we cut the cord in 5 seconds, whereas if we wait for 3 minutes, the babies get approximately over 45 milliliters per kilo. Column 4 shows you percent change, and you can see that if you delay 3 minutes, the babies get about 50% more red blood cells. Remember what red blood cells have in them. They're the major, where our hemoglobin and where 80% of our iron is. So we're going to talk more about iron later. This is a more recent study done by a colleague from England who she left the cloth off the baby. Before you have a heart attack, she left the cloth off the baby so she could get a picture. But all the babies were covered and warm. They didn't get cold. But I know I need to say that right away for the neonatologists in the group. Anyway, what she did was she wanted to validate that last study, and so she wanted to see how much weight the babies gained from delaying the cord clamping. So she rigged the scale here. This is a scale that's attached to this computer. And you can see the baby with the cord still attached here on the scale. What she found, here you see the baby, I can't really read these numbers very well, but anyway, these are 1 minute intervals here, all the red arrows, so she left the baby attached, it looks like for about 10 minutes, but you can see the baby gaining weight as the blood is transferred to the baby, and continuing on, these artifacts are probably the baby's moving. And she found a median of 80 mils, or about 25 milliliters per kilo, that the babies gained over the time that the cord clamping was delayed. This is approximately what it takes. This is about how many blood tubes that 80 cc's of blood, which we would estimate from a 4 kilo infant, just to give you a reference point.